Welcome, ladies and gentlemen, to this exciting video that I'm putting together for your lecture on medical terminology. So medical terminology is very important when we're talking about the body, how the body works, specifically diseases, how things are named, and medical terminology. If we know medical terminology, we're able to look at the name of something and figure out kind of the basics of what's going on with this medical condition or with these structures in the body that maybe we haven't seen the names of before. We can figure out what's going on with it just by looking at the name, by breaking it down into all of the parts that kind of go into it. Okay, so there are three parts of medical terminology that we need to know. We need to know word roots, we need to know prefixes, and we need to know suffixes. So I'm not going to go over every single word root, every single prefix, every single suffix. That's way too much. You will doze off by the time we are a quarter of the way through this video if I do that. So I'm focusing on the main ones that that maybe you might have a little bit of trouble coming up with. Stuff like some terms are so close to what the actual structure is. I'm not going to include those. Stuff like esophago, that refers to the esophagus, right? You should be able to figure that out. But something like gastro might be a little bit different and not really match up with stomach. Okay, so medical terminology has roots in Latin and Greek, and sometimes these terms, a lot of these, a few structures in the body have multiple different terms for them, different names, if you will, word roots, and prefixes and suffixes as well. And that's because they originated in two different languages. So one might have a Greek origin, one might have a Latin origin. Sometimes it's kind of a combination of the two. It's whatever. So just be aware that that's why we might have something like nephro and reno mean the same thing, because they could come from different languages, but they both mean kidney. Okay, so let's begin. And we're going to start with cardiovascular word roots. So how these are kind of labeled is we have the word root, and it has a slash and then like an O or an I or an A or an E at the end. And that slash and O is just where that term would kind of connect to a suffix to make it another word, a different word. Okay, so well, again, we're starting with our cardiovascular word roots, and we're starting with angio. So a couple examples: angioplasty or angiotensin. So angio, again, we're in the cardiovascular system right now. So what is an angioplasty? Typically done if somebody has something like, let's say, arthrosclerosis or arteriosclerosis. What do those have to do with the body? Angio means vessel. Okay, so vessel, a blood vessel specifically in the cardiovascular system. So angioplasty is repair of a blood vessel. So putting something like a stent inside of a blood vessel. And it doesn't mean it has to be an artery. It doesn't mean it has to be a vein. It can be either one. It's just vessel, so some type of vessel. Okay, moving on, arterio. So a couple examples: arteriosclerosis, arteriole. Now some of these, the names actually kind of are pretty simple, I would say. All you have to do is kind of look at it, think about it for a second. Arterio, that has to be artery, right? I would hope you'd be able to figure out that arterio means artery. So it's not blood, it's not vessel. Again, that's angio, artery. So arteriosclerosis is hardening of the walls of the arteries. Arterio in sclera means hard. Arteriole, ol means small or little. Arterio refers to an artery, so it's a small artery. So when arteries branch off, they become arterioles, which then branch off into capillaries. Okay, athero. The prime example here is atherosclerosis, which is pretty similar to arteriosclerosis. You're going to see these uh, kind of interchangeably at times. You know, they're one is caused by the other, and vice versa. So athero refers to something that can build up inside of the arteries, something that you maybe shouldn't have a lot of building up inside of your arteries. When something attaches to the walls of the arteries, it is called plaque. So atherosclerosis is fatty plaque that attaches to the walls of the arteries, which can reduce blood flow. Not a good thing, especially in certain arteries like the coronary arteries. Definitely a bad thing. Cardio. Now you should know this. It's what I hate doing at the gym, of course. Cardio. Examples: myocardial infarction, cardiac, like cardiac muscle. Cardio, of course, heart. That's one of the easy ones. Of course, cardio, heart. Hemo. Example is a hematoma or a hemorrhage. Hemophilia, hemophiliac, somebody that suffers from hemophilia. So a hematoma, hemat, also means the same thing as hemo. Oma means tumor. Hemo means blood. So it's a blood tumor. Like if somebody gets into a car accident or something, they have this big thing on their head from where they like hit the steering wheel or something, and it's full of blood. That is considered a hematoma, and a lot of times that blood kind of coagulates in there, and when you pop it, you should watch videos. It's really gross. You pop it, you cut it open, and all this coagulated blood just starts kind of pouring out of it. It's pretty fun. A hemorrhage is bleeding. Okay, hemo, blood. Reg means bursting forth. So it's blood bursting forth. You're bleeding, basically. Leuko. Now you're going to see leuko in, a lot of these terms are actually interchangeable between body systems. Like this can also apply to the lymphatic system. You'll notice I did not list, I should say, I did not list any lymphatic word roots in this video because they're all just kind of spread out throughout the entire, all of the other body systems. So there's no reason to kind of rehash a lot of them. So leuko, example, leukocyte and leukemia. Leukemia, you could also use leuko in the oncology word roots. Leukocyte, again, could be part of the lymphatic system as well. So a leukocyte is also is a type of blood cell, right? What type of blood cell is a leukocyte? Now we only have really 3 blood cells, right? We have erythrocytes, leukocytes, and thrombocytes. A leukocyte is a white blood cell. Okay, so leuko means white. So leukemia, white blood condition. Well, it's in your book. Leukemia is in your book. Look it up. Phago. It's what I absolutely love to do, of course. I know it's not teach. Although I love teaching. I love teaching. It's not talking either. Sometimes I'd rather just be silent. And I know a lot of people watching my videos are probably like, that's not true. You talk all the time. Yeah, I do. Phagocyte, phagocytosis. What do phagocytes do? Leukocytes are types of phagocytes. Leukocytes make up our body's immune system, right? So how do they do that? What do they do with pathogens and debris in our body? How do the leukocytes get rid of those things that could put our body in danger? They do them by, quote unquote, eating those structures. So when a leukocyte comes into contact with bacteria, it takes it into the cell, and that is a form of eating the bacteria, and then it kind of dissolves the bacteria inside of it, and then poops it out, of course. Phlebo, like phlebitis or phlebotomist. Phlebitis. Of course, itis means inflammation, phleb. And we think about phlebotomists or phlebotomy. What do phlebotomists do? What do they do in regards to the cardiovascular system? Phlebotomists are the people that stab your veins with needles when you are doing stuff like donating blood. Okay, phlebitis is inflammation of a vein. So here's another example. Phlebo is also the same as veno or veno. Two different words, both mean the same thing. Okay, so phlebitis is inflammation of a vein, usually caused by either trauma or lack of movement of the vein. Sclero, a couple examples, scleroderma. Specifically in the cardiovascular system, we're worried about arteriosclerosis or atherosclerosis. And we talked about arteriosclerosis. Again, arterio means artery. Sclere means what happens to the walls of the arteries in arteriosclerosis. They become hard. Okay, so scleroderma is hard skin. So the skin becomes just really, really hard. Arteriosclerosis, the walls of the arteries become hard. Atherosclerosis, the fatty plaque inside the arteries, kind of solidifies, becomes hard as it builds up in the arteries. Thrombo, like thrombocyte or thrombosis. Thrombus. What is a thrombus? Something that we should probably watch out for if there's one floating around in the bloodstream. Not a good thing. Deep vein thrombosis is when we have what in the veins, usually in the legs. A thrombus, thrombo means clot. So a thrombus is a blood clot. Deep vein thrombosis is when we have blood clots, usually in the legs, which can be caused by something like phlebitis. A thrombocyte is a type of blood cell that produces blood clots. So when we bleed, our thrombocytes help to protect us by forming clots and stopping the bleeding. And veno, like venipuncture or venostasis. So venipuncture, if you've ever been in the hospital, had a stay in a hospital or had any type of surgery, chances are you may have endured some venipuncture. And again, a lot of this stuff isn't really trying to trick you. It's not that complicated if you just sit and think about it. Veno sounds like vein, so it's probably vein. The answer is vein, of course. Of course it's vein. Now we're moving on to the digestive word roots. So a lot of these the example I gave earlier with esophago means esophagus, right? A lot of these kind of do match up, but some of them don't, and some of them can be a little tricky. Okay, so let's jump in. First one, chole. Example, cholecystitis or cholelithiasis. Say that 5 times fast. Okay, so cholecystitis. So it's we see itis. We see the suffix itis. Of course, that means inflammation. So something's inflamed. Chole. Cyst. Like a cyst. It's an actual cyst. No. Well, what do cysts do? What do cysts in the body do to our body? Cysts in the body are there to hold things inside of them. So if we have like a sebaceous cyst, the body develops this membrane around some sort of infection or buildup of something like sebum with sebaceous cysts, and that just kind of holds it inside of it. That's why cysts are called cysts, because they hold things inside of them, just like these organs. Organs that hold things inside of them, and that's all they do, are bladders. So we're in the digestive system, not the urinary system, right? So what bladder do we have in the digestive system that just holds some sort of fluid inside of it? It is the gallbladder. So chole, well, first, what does the gallbladder hold inside of it, of course? It comes from the liver. It's produced by the liver, then emptied from the liver into the gallbladder. And this helps to kind of emulsify fats, break down fats and make them easier for us to absorb into the body. It is bile. Okay, so chole means bile. So cholecyst cholecysto refers to the gallbladder. So the gallbladder, of course, holds bile. Chole means bile. And of course, we just kind of talked about this one, cholecysto. I just gave you the answer. A lot of these, it does just kind of give you the answer as you talk about it. Okay, so cholecysto, again, like cholecystitis, cholecystectomy is another one, is the gallbladder specifically. So chole means bile. Cholecysto is the bladder that holds the bile, the gallbladder, okay? So you can see how this is all kind of coming together. So you got those two word roots that connect to each other to make one structure, the gallbladder. So cysto by itself just refers to bladder. Chole by itself refers to bile. You combine chole and cysto, and that makes the gallbladder. Okay? So cholecystitis, again, inflammation of the gallbladder. Cholecystectomy, surgical removal of the gallbladder. Colon. Now, a lot of people, you see that, and you're going to say, colon. Yes, of course. But what is the colon? What organ is the colon? Another example, colitis, inflammation of this structure. Now think about an organ that has the term colon in it a few times, actually like 4 times. What about ascending colon, transverse colon, descending colon, sigmoid colon? Those are all part of the large intestine. Okay, so colo means large intestine. Colitis, inflammation of the large intestine. Colonoscopy, you're putting a camera into the large intestine to take a look. Okay, dento. Now we should all know this one, right? A lot of the stuff we use in everyday life, like dentist or dental. A dentist is somebody that specializes in teeth. Okay, dento or donto also means teeth, like the periodontal ligament. Gastro. I kind of talked about this earlier. Gastritis, inflammation of. Gastrology, study of this structure. Gastro means stomach. So gastritis, usually like stomach flu, you have inflammation of the stomach, and that can make you do things like vomit, which is not very fun. Trust me, I do it all the time. Not very fun. Glosso, like hypoglossal, like the hypoglossal nerve. What about glossary? A lot of this stuff can translate, again, into everyday life and with other words as well. Glossary is a perfect example. So hypo means below. Glossal refers to the tongue. Okay, think about glossary. A glossary, use your tongue, right, when we're talking. Hepato, like hepatitis, or hepatic portal vein. Okay, but mainly you're going to see hepatitis. That's the really important one to know, hepatitis. So hepatitis, inflammation of, somebody has hepatitis, which can be caused by a viral infection. It can be caused by drinking far too much alcohol, constant irritation of this organ. It is the liver. It can cause the liver to produce way too much bile. It can damage the liver, not a good thing. Cause cirrhosis of the liver. A lot of bad things can happen when you have hepatitis. So hep or hepato means liver. Oro, for example, oral, like the oral cavity. What about orbicularis oris? That's a muscle, right? Orbicularis oris is a muscle. It's arranged in kind of a circular manner, which gives it the name orbicularis, like an orb. Okay, oris. You find it around the mouth. The oral cavity is the mouth. Okay, endocrine word roots. Adeno, like your adenoids, which aren't actually this, but they resemble this. Oid means resembling, so they kind of look like these structures. An adenectomy is surgical removal of a gland. So a lot of times if you have a gland removed, it'll be specific to that gland. It'll be named, oh geez, a thyroidectomy or something like that. So you can have an adenectomy and have the adenoids removed. That would be considered an adenectomy. Or you can have an actual gland removed, and just a general term for that is adenectomy. Adreno, like adrenaline. Anytime you see the word adreno, you know it has something to do with the adrenal glands. And even adrenal can be broken up into a couple different parts. Medical terminology is it's a weird language to learn. So ad means towards, reno means kidney. So the adrenal glands are toward the kidneys. So they're the glands basically sitting on top of the kidneys, right? So I mean, adreno is just one more word that you can break up into multiple different parts, and it's a word root itself. Okay, gluco, like glucose or glucagon. What is glucose? Glucagon, what does that increase the amount of in our bloodstream? Glucagon increases the amount of sugar we have in our bloodstream, which helps give us energy, right? Too much sugar in our bloodstream, bad though. Glucose, sugar. Okay. Homeo, like homeostasis. You're like, why is this part of the endocrine system? Well, hormones play a major role in homeostasis and maintaining homeostasis and trying to keep the body to like tries to keep the internal environment the same, tries to get it to stand still. Homeostasis means same, standing still. So the internal environment is trying to stay the same and stand still, trying to keep it around that kind of set point for chemical content or temperature. A lot of factors that go into homeostasis. So homeo means same. Kali, like hypokalemia. It's when you have too little of this nutrient in the body. We have to have a certain amount of specific nutrients in our body to function properly, to maintain homeostasis. Potassium is one of those substances. Okay, so Kali means potassium, and what's the abbreviation? I think it's a K, right, for potassium, and that's why. Yeah, that was pretty short, huh? Now we're on to the integumentary word roots. So our integumentary system, our skin, of course. We'll start with adipo, like adipose. So adipose tissue is a form of connective tissue used to kind of cushion the body, useful in temperature regulation, specifically heat, traps heat in the body, which is why I'm never cold, of course. It is fat tissue. Okay, so adipo, like adipose, is fat. Albino, like albinism. Now, some of these, especially with the skin, kind of refer to color. They can refer to color. And albinism, albino, is one of these colors that we need to worry about. If somebody has albinism, their body isn't producing melanin, right? And melanin is what gives the skin a darker skin tone. And if you don't have melanin, the skin becomes white, okay? Or whiter. And some people can have stuff like vitiligo, where only part of the skin has a lighter color, and the rest it has melanin in it. But yeah, you get it. Cutaneo, like cutaneous. Cutaneous refers to What is cutaneo? Well, it's the skin. Okay, so if something refers to the something is in reference to a cutaneous area, um, subcutaneous, below the skin, like a subcutaneous injection. That's another example. It is an injection that goes below the skin. It doesn't go into the muscle or anything like that. It's not in the skin, below the skin. Cyano, like cyanosis. What is cyanosis? Has something. This is another color, of course. So cyanosis can occur if you are choking or if you have something like hypothermia. What color does your skin turn? Really noticeable on like the lips, maybe the hands as well. Turns blue. Okay. So something that can happen in people that might be having myocardial infarction or cardiac arrest or something like that. Just the skin, the color turns blue. Okay, dermo, like dermatitis, or dermis. Of course, itis means inflammation, right? Eczema is the form of dermatitis, called atopic dermatitis. What about contact dermatitis? The dermis. What about epidermis? Dermo means skin. Okay, so dermatitis, inflammation of the skin. The dermis is the skin. The epidermis are the layers above the skin. Ichthyo, like ichthyosis. Ichthyosaur is the state fossil of the deer state of Nevada, where I currently reside. It's pronounced Nevada, not Nevada. Don't say that. Ichthyosis. It's specifically a skin condition where the skin develops just kind of this scaly appearance. Okay, so it kind of looks like fish scales or something like that on the skin. It can be really dry, kind of itchy, not good. Jondo, like jaundice. So somebody with hepatitis might develop jaundice, which you can really see in the skin. Now, some people might have a darker skin tone, but there's one part of the body you can always see jaundice in people, and that's in the eyes. What color do the eyes turn when somebody has jaundice? The eyes turn yellow. And it's not just regular, maybe a little bit of discoloration due to like irritation, allergies. It's the sclera of the eyes, the white of the eyes becomes a yellowish color. Okay, kerато, like keratin. I mean, that's the prime example in the integumentary system is keratin. And we have keratin all over the skin, right? So keratin means hard. So it's a hard area of the skin, usually caused by an increased amount of pressure and friction on an area. So when I lift weights, I get a buildup of keratin on my hands where I'm holding the barbell or the dumbbell right below my fingers at the distal end of my metacarpals. Okay, so keratin you can also find in warts, and that's why warts kind of feel hard to the touch because they are basically an increased amount of keratin that the virus kind of makes the body produce. Okay, melano, like melanin or melanoma. Melanin. Melanin does what to the skin? Melanoma. Oma means tumor. What color is the tumor in somebody that has melanoma? Melanoma is a black tumor. Okay. So if somebody has an increased amount of melanin in the skin, then their skin tone is darker in color. If somebody has melanoma, they have a black tumor. And that's one of the signs of melanoma is the color, because stuff like moles are typically not black. So when you have a mole or something, especially one that's kind of just appeared, and it's got a really, really dark black color, that can be a sign that it's melanoma. Onychomycosis. Onychomycosis. Well, myco, I know we did not go over this one, but myco means fungus, okay? Osis means condition. So it's a fungus that you find somewhere on the body that has to do with the integumentary system. Onychomycosis can be something that can be associated with athlete's foot. That doesn't mean it is athlete's foot, but when athlete's foot then kind of spreads into this part of the body, then it becomes onychomycosis. You can also get these on the hand nails as well. No, I just gotta give it to you. Onycho means nail. Okay, so onychomycosis is a fungal infection. Myco, fungus. Osis means condition. Onycho, nail. So nail fungus condition. Pylo. An example is the erector pili. And pili is the plural form, of course. So the erector pili are muscles that in the skin that attach to this specifically. Erector means to stand up, right? And what do they stand up in the skin? The erector pili muscles stand hair up, okay? So erector pili stands hair up, gives us our goosebumps, basically, which is kind of a defense mechanism for us. It helps with temperature regulation. Doesn't really work that well on humans because we don't have as much hair or fur as like animals, but when animals are cold, their erector pili stand their hair up and trap heat beneath the fur, beneath the fur, between the skin and the fur, and that creates kind of like a blanket for them to keep them warm. And now you know. Squamo, like squamous cell carcinoma. Squamo. Some people say squamo. I say squamo. That's just me. So squamous cell carcinoma, it talks about what the type of cancer, what the tumor actually looks like. Squamo means scale. Now another example is the squamous suture on the side of the skull that connect the temporal bone to the parietal bones, okay? So both of those kind of look like scales. The squamous suture creates kind of a scale-like appearance. The squamous cell carcinoma kind of looks like a scale on the skin. Okay, moving on to muscular word roots. We'll start with adheso, like adhesion. Now, glue is an adhesive, right? Tape is an adhesive. What do both of those do to two different things? Because that's what adhesions in the muscles do. They stick to, okay? So they just basically stick things together. So adhesions, kind of like scar tissue and muscles, can stick things together and keep them from moving. Adhesions in the skin, or scars in the skin, stick the two sides of the damaged tissue together. Okay? Tape and glue, they stick to things, they stick things together. Flexo, like flexion. Now, a lot of people have trouble with flexion and extension. Yeah, which is which? Which is which? I don't understand the difference between the two. It all has to do with angles. So anytime an angle of a joint decreases, it flexes. Anytime an angle of a joint increases, it extends. So flexo means bend. Okay, so that joint is bending in some way. The angle of that joint is getting smaller. It is bending. Whereas extension, it's not. Okay, iso. Example, isometric or isotonic. So these are muscle contractions that you really, really should know. Okay, metric means length. Tonic means tension. So in these two types of muscle contractions, something is changing and something is staying the same. Iso means same. So in an isometric contraction, the length is staying the same, but tension is changing. Okay, like if you're trying to pick something up that's too heavy, you just can't do it, but you have tension in that muscle. The length is staying the same. It's not changing because it's too heavy for you, but the tension is changing in some way. Okay, isotonic, the length is changing, but as the name said, the tension is remaining constant, not changing, same tension. Okay, so like concentric and eccentric contractions are examples of isotonic contractions, and go look at my previous videos for that, of course. Kinesio, like kinesiology or kinesthetic. Kinesiology. Ology means the study of. Now, when we think about kinesiology, what do we think of? We think of muscles, we think of bones and bony landmarks, and all of that together, along with the nervous system, allows us to do what? Muscles, bones, and nerves working together allow us to move. Okay, so kinesio means movement. Kinesiology is the study of movement. And of course, you have to know muscles and stuff like that, because muscles, when they contract, allow us to move because they pull on the bones. Okay, metro, like isometric. Now, we just kind of talked about this. Isometric, iso means same. Metric means, like when we measure something in the metric system, we're measuring length. So, metro means length. Isometric, same length. So with that muscle contraction, the length of the muscle stays the same. Recto, like rectus femoris or erector spinae. So the rectus femoris is a muscle, one of our quadricep muscles, of course, the only quadricep muscle that crosses the hip. Basically, the function of the rectus femoris is to stand us up straight, right? Lets us stand up. Rectus femoris. If rectus femoris didn't contract, then the hip would not flex, the knee would not extend, both of which we need to help us stand up straight. Okay, tendo, like tendinitis. Now you should be able to figure this one out. Just take out the suffix itis, and that gives us our definition. Tendinitis. Tendo means tendon. You could also see something with tendinitis. You could see tendinitis. It's the exact same thing. Just a weird spelling thing. I don't understand it. Torti, like torticollis. Now, really, this torsion is another one. I'm not going to get into a specific example that I've heard, but it sounds terrible. But torticollis, something you find in kids a lot, babies a lot. It's when the neck is basically twisted. Okay, so sternocleidomastoid can become way too tight on one side, and that can cause the neck to kind of twist to one side. So torti, like torsion, means twisted. Okay, nervous word roots. Cranio. An example is cranium. The cranium is part of what region of the body? What portion of the axial skeleton is the cranium a part of? It's a part of the skull. Okay, so cranio pretty much refers to skull. Now the skull is, all of the bones together, but cranio specifically refers to the parietal, frontal, temporal, and occipital bones, the region that really help to protect the brain. Okay. Dendro means, an example is dendrite, which you find on neurons, which are nerve cells, of course. Dendro Dendrite means little. Little what? They look like. Now, some people say fingers, but they are actually named after trees. They look like little trees coming off of the cell body of a neuron. Okay. Encephalo. Now this is another one where you can actually break this up into smaller terms as well. A couple examples: encephalitis, encephalopathy is a disease of this. Encephalitis is inflammation of this. So let's break this down a little bit. En means inside. What about sep? Think about bicep or tricep or quadricep. Bicep has 2 what? Tricep has 3 what? Quadricep has 4 what? Bicep has 2 heads. Tricep has 3 heads. Quadricep has 4 heads. So en, sep, head. So what is the structure you find in the head? And don't overthink this. Do not overthink. The structure you find in the head is the brain. Okay? So encephalitis, inflammation of the brain, which is not a good thing. Usually a viral infection causes encephalitis. Encephalopathy, a big disease that people are talking about these days is CTE, or chronic traumatic encephalopathy. It's where you repeatedly have brain injuries, concussions and stuff like that, and that causes your brain tissue to kind of degenerate, and you can have some pretty bad brain damage over time. Chronic, of course, traumatic encephalopathy, CTE. Okay, aesthesio, like anesthetic. Anesthetics are medications, right? Anesthesiologists are people that apply anesthetics when you are going into surgery, right? So that you don't have any, of course, an is a prefix that means without. So you don't have any sensation. So you don't feel what's going on. So you're completely numb to everything that they're doing to your body. Okay? So anesthetics are medications that give you no sensation, without sensation. Neuro, like a neuron or neuralgia. Neurons are what type of cell? Neuralgia. Algia, the suffix algia means pain. Pain of what? A neuron, you get a bunch of neurons together, of course, that makes a nerve. Neuralgia is nerve pain, like trigeminal neuralgia, pain in the trigeminal nerve. What about neurology? Neuritis, inflammation of a nerve. There are lots of examples. Okay, synapto, like synapse. This is pretty much the only time you need to know this, but synapto is a point of contact. Now the prefix syn, which kind of synapse applies to as well, means together. Okay, so a synapse is where two structures kind of come together and they don't touch. There is that little space in between where neurotransmitters can kind of travel back and forth, but a synapse is considered the point of contact where these two structures come together. Okay, reproductive word roots. Cervico. Now you can, of course, this does apply to the skeletal system as well. Okay, but specifically in the reproductive system, we're talking about the cervix. That's what this applies to. So the cervix, if we know our female reproductive system, we know that the cervix is a kind of a little area between the vagina and the uterus. It's considered the neck. Okay, so cervical means neck, like the cervical region of the vertebral column is in the neck, right? So consider the uterus the head, then the cervix is the neck, and then the vagina, the passageway, is considered the the trunk. We'll just call it the trunk. Okay, gyneco, like gynecology. Gynecologists. What do gynecologists study? specifically the female reproductive system, but gyneco specifically means woman. Okay, so gynecologists. I mean, I don't see a gynecologist because I'm not a woman. Hystero, like hysterectomy, is where the term hysterical also came from. That's not. I didn't make the language. Don't come after me. I'm just reporting. Hystero, a hysterectomy, a surgical removal. Ectomy means surgical removal of this specific structure, and you're probably going to have other structures removed as well, not just this structure, but primarily this structure is removed. It is the uterus. Okay, so hysterectomy can also take out like the fallopian tubes and the ovaries and the uterus, just all that stuff gone. Lacto, like lactose or prolactin. Lactaid is a product you can find in a grocery store. Lactaid, you can find it in which section of the grocery store? Some of you know it, some of you don't. Prolactin is a hormone produced by the pituitary gland that stimulates the production of this, that both men and women can make. I mean, women primarily make this far more often than men, but men can definitely make it if they have enough prolactin in their body. So lacto means milk. So lactose is a milk sugar. Prolactin stimulates the production of milk. Lactate is, I think it's milk without lactose in it. I don't know. My wife was lactose intolerant for a while. I can't remember if she used Lactaid. I don't know. That was a long time ago. Mammo, like mammogram, or mammary glands is another one. So mammary glands are glands that you find inside of a breast. A mammogram is a test performed to where they squish the breast tissue between two glass plates and then perform imaging procedures to see if there are any tumors or any irregularities in breast tissue. Okay, masto, like a mastectomy, or here's a weird one: mastoid process. On the back of the skull, behind the ear, named after what it looks like. Oid means resembling, of course. So it looks like what? Think about its shape. Mastectomy, surgical removal of this structure, also means breast. Okay, so the mastoid process, the back of the skull, looks like a breast. A mastectomy, surgical removal of breast tissue. Typically done if there's a chance, if somebody were to have breast cancer, or there is a chance somebody could have breast cancer. Oftentimes they get mastectomies performed, get all that tissue out of there, decreases the chances of developing breast cancer. Okay, meno, like menopause, or menstruation. How about that? What do you think? Menopause, pause. So when we pause a movie or something like that, we stop it, right? So what stops? Menstruation. So meno means menstruation. Menopause, menstruation stops. So you just stop menstruating, and at that point, yeah, no longer can produce children. Okay. Like an oocyte. An oocyte, of course, the suffix "cyte" means cell. So what type of cell is this? Now this is a female cell. I don't have these in my body, I don't think. Of course, I never really tested for it, so maybe I do. I don't know. It is an egg cell. Okay, so an oocyte is an egg cell. which is produced by oophoro. Structure. Well, that has the double O thing, right? So double O means egg. Eggs come from these structures, which are glands. And oophorectomy is surgical removal of these, which my wife has actually had performed on one of them, an ovary. Okay, so in my study guide, go to, if it's in there, I can't remember. I don't know. In my regular MBLEx guide, maybe it's not in there, but in my pathology book, it's definitely in there. Go to the section on polycystic ovarian syndrome, and you'll see my wife's ovary. It's about the size of a softball. So oophoro means ovary. So you see that double O, you know it refers to an egg. So oophoro, ovaries produce oocytes, which are egg cells. Salpingo. How about salpingitis? Inflammation of this. Now these are the structures you find between the ovaries and the uterus that egg cells travel through. It's where the majority of fertilization of an egg cell takes place. Fallopian tubes. Okay, so salpingitis, inflammation of the fallopian tube. Moving on to respiratory word roots. Breathing, of course. Embolo, like an embolus. Embolism. What is an embolus? What does an embolus do? You have an embolus in your body. See, a thrombus can become an embolus, of course, when it becomes like a plug and it plugs up something like an artery or a vein and reduces blood flow into or out of a blood vessel. So an embolus, and it's not just blood clots either. There's a reason you get all of the oxygen and bubbles out of needles when you are injecting some sort of medication, because those don't pop when they're in the blood. They can just kind of hang out. They can travel throughout the bloodstream and potentially get stuck somewhere like your heart, your lungs, which is pretty common. I mean, when people get an embolus, the lungs are a common place people get them, or the brain, and that can cause some major problems, possible stroke, and stuff like that. Not good. Embolus, not a good thing. Don't want anything plugging up part of your body. Okay, emphyso, like emphysema, and that's pretty much the only time you're going to see it. Emphyso. So what happens in emphysema, specifically with the alveoli in the lungs? They deteriorate and then distend, and when they distend, they look like they have inflated. Okay, so emphyso means inflate. So the alveoli look like they're balloons, but okay, at first they kind of look like a big cluster of grapes, and when they deteriorate, they get bigger. That tissue between them, that all the capillaries kind of move across, all that surface area kind of disappears and it becomes just one structure. It looks like that it has inflated like a balloon, like one big balloon instead of a lot of smaller balloons that have a lot more surface area. Okay, phono, like telephone. What do we do on the telephone? What are telephones used for? I mean, these days, well, you can use your telephone without actually doing this, producing sound, talking to people, of course, using your voice. But phono means sound. Telephone, you're supposed to be talking into a telephone and producing sound. Okay. Pneumo, like pneumothorax or pneumonia. A pneumothorax is when you have an air bubble in your chest caused by a puncture of this structure. Pneumonia is typically a bacterial infection that causes an increased amount of fluid in these. Pneumo means lung. Okay, so a pneumothorax, if you have punctured your lung, you might develop some air in your chest. It could be a collapsed lung that produces it. Not a good thing. You don't want a bunch of air just hanging out in your chest. You want it in the lungs. And pneumonia, bacterial infection that causes increased amounts of fluid to build up in the lungs. Pulmo, like a pulmonary embolism, or pulmonary arteries, or pulmonary veins. Anytime you see pulmonary, it refers to lung. Like a pulmonary embolism, again, we talked about an embolus earlier. That's when you get a blood clot or a bubble of gas or something like that blocking part of the lung, either blood flow or airflow or something like that, just stuck in the lung. Pulmonary arteries carry blood from the heart to the lungs. Pulmonary veins carry blood from the lungs to the heart. Okay, so pulmo, lung. Anytime you see pulmonary, you know it has something to do with the lungs. Rhino, like a rhinoceros. A couple of specific examples, human-related. Rhinitis, inflammation of this. Rhinoplasty, surgical repair of this. Of course, we think about rhinoceros, we think about that big horn, right? And that horn is located where? On the nose of the rhinoceros. Okay, so rhinitis, inflammation of the nose. Rhinoplasty, it's basically a nose job, right? Spiro, like spirometry. Well, spirometry is, I've actually had this done. I do have asthma, some sort of breathing disorder. So you get spirometry done to measure a person's breathing and how well they breathe, how, the depth of each breath and how much air they're taking in, how much air they're exhaling at a time. My breathing is fine, by the way. So spiro means breathe. Stetho, like stethoscope. Well, that's pretty much the only time you're going to see that, either stethoscope. So we know the stethoscopes, right? You got the things that go in the ear, and you got the bell that you put up to somebody's chest. Of course, chest. So stethoscopes basically let us hear things, hear noises inside the chest. So you can hear somebody's breathing, you can hear heart rate, you can even hear the digestive organs doing their thing if you really want to. Stethoscopes, they're not that expensive. Go grab a pair, listen to some heartbeats and breathing, of course. Thoraco, like the thorax, or the thoracic vertebrae. The thorax is considered what part of the body, what region of the body? The thoracic vertebrae. Now we know the thoracic vertebrae refers to, the region of the vertebral column. And you think of the vertebral column, you think of the back, but the thoracic vertebrae refers to the thorax, which is the chest. Okay, so anytime you see thorax or thoracic, it refers to the chest in some way. So the thoracic vertebrae kind of match up with the rib cage, which makes the chest or the thorax. Okay, skeletal word roots. Acro, like acromion process. Acro. So I think of the acromion process and where it is. It's right next to the shoulder joint, right? Right at the shoulder joint. Right where an extremity attaches. Okay, so the acromion process, again, right by that shoulder joint, right where that extremity attaches to the body. Ankylo, like ankylosing spondylitis. Ankylosaurus. Fun thing about dinosaurs also, they have a lot of Latin and Greek names, so a lot of these do transfer over to the dinosaur realm as well, like Ankylosaurus. Ankylosing spondylitis, however. is a medical condition involving the vertebral column, specifically the intervertebral discs. It's an autoimmune disorder. The discs kind of degenerate over time, and that causes us to lose the space in between the vertebrae. They can sit on top of each other. Eventually, you're not going to move because bone is grinding on bone, and that's painful. So the bones start to fuse together and gives you something like kyphosis. Not a good thing, of course. Another name for it is bamboo spine, because it makes the vertebrae, after they fuse together, they kind of look like a stalk of bamboo. Anyway, ankylo means crooked. So when you develop ankylosing spondylitis, again, it can give you kind of kyphosis, and where you have that hunchback appearance because you have lost the discs between the vertebrae, so there's nothing kind of keeping them upright. You just kind of the body just kind of looks crooked, falls over on itself. Okay, arthro, like arthritis, and articulation is where what joins together? Arthritis, inflammation of, like osteoarthritis or rheumatoid arthritis. Arthro means joint. Okay, so arthritis, inflammation of a joint. Osteoarthritis is wear and tear arthritis. Rheumatoid arthritis, inflammation of the joints, that's another autoimmune disorder. And articulation is where two bones come together. That makes a joint. Okay, brachio. An example, biceps brachii. How about brachialis? Coracobrachialis. Brachioradialis. A lot of muscles named after this. This is a specific region of the body, of course. The brachial artery, same thing, named after this region of the body. The artery is found where? The brachial region is the region of the arm. So biceps brachii you find in the arm. Brachialis, coracobrachialis, brachioradialis all have something to do with the region of the arm. The brachial artery is a large artery in the region of the arm. A lot of blood passes through the brachial artery. You don't want to damage that, of course. Okay, cephalo. Now we kind of talked about this one earlier with the encephalitis, right? En means in. What does sep mean again? Like biceps or triceps or quadriceps. Cephalo, cephalosporin, biceps brachii. Cephalo means head, okay? So cephalosporin is a type of medication, kind of an antibiotic, a cream, if you will. Biceps brachii, again, bicep to head. So encephalo, in the head is the brain. Okay, chondro, like costochondritis. Costochondritis, so inflammation of something and this, or this is associated with that other structure. All right, chondro, cartilage. All right, so costochondritis, it's inflammation of the costal cartilage. The costo means rib, chondro, cartilage, itis, inflammation. So chondro, cartilage. Clydo. Pretty much the only place you're ever going to see this is in this muscle, sternocleidomastoid. So mastoid would refer to the mastoid process, right? That we just talked about. It looks like a boob. Sterno. You got to know that means sternum, right? What does clydo mean? What articulates with the sternum? What bone articulates with the sternum? It's not the ribs. What is that? That one bone. Some people call it the collarbone. Oh, I hate that so much. Use the actual name, please. It is the clavicle. Okay? So sternocleidomastoid just basically tells you all of its attachment sites. The sternum, the clavicle, the mastoid process. Fun thing about muscles is a lot of times they're actually just named after where they attach. Here's a prime example. Okay, so cleido means clavicle. Costo, and we just kind of talked about this with costochondritis. A couple examples: intercostal or costal cartilage. Of course, the costo means rib. Costal cook-off. We have a big event in Reno every Labor Day weekend, the rib cook-off. It's one of my favorite things. Costal cook-off, of course. Kypho, like kyphosis. Now, kyphosis, of course, kind of that hunchback appearance, right? We have four curvatures in the vertebrae. Two are kyphotic and two are lordotic. The ones that are kyphotic goes posteriorly. So in the thoracic region, that's a kyphotic curve. In the sacral region, that's a kyphotic curve. The curvature in the cervical region and the lumbar region are lordotic curves. They go towards the front. So if you have somebody laying prone on a table, and you look at their back, you look at the thoracic and the sacral regions, it looks like, if you just imagine them as kind of the horizon, you're looking at the horizon. You look at them from the side as they're laying face down. Look at them from the side, it looks like they have hills on their back, right? Kypho means hill. Listen, I didn't name this stuff, all right? So I'm just telling you what this means. I'm trying to explain it best I can. So kyphosis creates kind of an exaggerated hill on the back where you get that hunchback appearance. Okay, so a kyphotic curve creates a hill. Looks like a hill. Whatever, you get it. Lordo, like lordosis. Okay, so we got kyphosis creates like a hill, and of course lordotic curves go the opposite direction. They go anteriorly. And when you look at somebody, maybe see, it's hard because you can do it either way. When you're looking at somebody like from the side, you can look at the kyphotic curve, and you're like, oh, that's doing the same thing as this one, but this specifically means curve. Like you got the four curvatures, right? They're all curvatures, but lordo specifically means curve, where kypho means hill. So just imagine somebody just laying face down on the table, and then you can really get a good visualization of it. Okay, so lordo means curve. Lordosis is a hypercurvature of a lordotic curve, where you find the lumbar vertebrae and the cervical vertebrae. Okay. Ortho, like orthopedic. Orthotics are things that you put in your shoes to help you stand straight. Okay, so orthopedic medicine specifically has to do with muscles and bones and stuff. A lot of that has to do with the spine and stuff like that. It helps you stand up straight. The knees are also a really, really common one to deal with orthopedic medicine. The hips as well. Osteo, like osteocyte, osteoblast, osteoclast, are all things that have to deal with these structures. Of course, osteo means bone. Okay, so an osteocyte is a bone cell. Osteoblasts are immature cells or germ cells that build bone tissue, and once enough tissue has been built, then they mature and become osteocytes. Osteoclasts are cells that break down bone tissue. Pedi, like a pedicure, which I'm desperately in need of. Just looking at my feet, like, man, I gotta get in and get taken care of. Of course, I just kind of gave it away. Foot. Pedi means foot. Okay. Podo, you can kind of say it either way. Podiatry is a prime example of this one. Podiatry. Now, there's a difference between pediatry, P-E-D, and podiatry, P-O-D. Pediatry deals with children. Okay. Podiatry deals with the foot. So podiatrists are foot doctors, basically. So they're the ones that can tell you either you are over supinating or over pronating your feet, or that's inversion and eversion for those of you who are unaware. So yeah, podiatrists deal with feet. Pediatrists deal with children. Scolio, like scoliosis. So if we were to look at somebody's back, somebody who has scoliosis, their vertebrae doesn't look straight, right? It looks a little abnormal. It looks like it's not an S shape. It looks like it is kind of like ankylo. It is crooked. Okay, so the vertebrae isn't straight. It is going off to the side. It is crooked at that point. So it's like ankylo, same kind of definition, just crooked in a different way, where ankylosing spondylitis can make you crooked going in kind of anteriorly, give you that kyphotic curve, that hyperkyphotic curve. Scoliosis, the vertebrae are going to go laterally, usually also takes place in the thoracic region. Okay, spondylo, like spondylosis, or hey, we just talked about it, ankylosing spondylitis. So spondylosis is just a general term, any form of condition that has to do with the vertebrae. Think about ankylosing spondylitis, inflammation of the vertebrae that causes the vertebrae to become crooked. That's how you can kind of break down that that name, ankylosing spondylitis. Okay, so spondylitis, inflammation of the vertebrae, specifically the intervertebral discs. Right, but can also maybe cause a little bit of irritation and inflammation when you have the vertebrae sitting on top of each other, when the discs are completely degenerated. All right, moving on to urinary word roots. Okay, cysto, like cystitis. We already talked about cysto a little bit earlier, right? With cholecystitis. Chole means bile, itis, inflammation. Bile, where does the bile go? After it leaves the liver, it goes into the gallbladder, right? So we have a couple bladders in the body. That's not the only place you have a bladder. Cysto, of course, just means bladder. Cholecysto means gallbladder. Cystitis would specifically refer to the urinary bladder, okay? So again, bladders are just things that hold things inside of them, hold fluid inside of them. Okay, so cysto, bladder, cystitis, inflammation of the bladder, usually caused by bacterial infection. Nephro, like nephritis or epinephrine. Here's another term that you can kind of break down into multiple parts. Epi means above. Neph, we're going to talk about kidney. Or I guess I just kind of told you. Rin means secrete. So above, kidney, secrete. Epinephrine comes from the adrenal glands above the kidney, and they secrete. Right? Nephro means kidney. Nephritis is inflammation of a kidney. A nephrologist is a doctor that specializes in kidneys and kidney function. Okay, pyelo, pretty much the one example you're going to need for this. Pyelonephritis is a bacterial infection where bacteria moves all the way up the entire urinary tract and gets into the kidneys, and specifically affects this part of the kidney, the renal pelvis. So the very bottom of the kidney is what pyelo refers to. So pyelonephritis, inflammation of the renal pelvis and the kidney. Okay, Reno. Not just where I'm from, of course, Reno. Renal failure is an example. Adrenal gland, we talked about that earlier. Ad means toward. Renal means the adrenal glands are toward what structures? They sit on top of the kidney. Okay, so reno means kidney. Renal failure is kidney failure. Uro, like urology. Now this one maybe you should be able to get this one. I think you should be able to get it just by looking at it. You are, of course, urine. You're in trouble. I'm just kidding. You are not in trouble. Urine. Okay, so urology. Uric acid refers to urine. Okay. Oncology word roots. So oncology, study of tumors. Blasto, like osteoblast or blastoma. Now we talked about osteoblasts. Osteoblasts are cells that do what? Now, fun thing about a lot of these terms is sometimes you can have a term be a word root and a prefix or a suffix. It's a weird thing, a really weird thing. Like dermo can also be derma, the suffix derma, like scleroderma, hard skin. Just know that they're all the same. They all mean the same thing. It doesn't matter if it's a prefix, suffix, or whatever. Okay, so blasto, like osteoblast. In this case, blast would be the suffix, but still applies. Blasto means germ cell. So osteoblasts, again, are germ cells that divide until they make enough bone tissue, and then they mature into osteocytes. Okay, so moving on. Carcino, like carcinoma, or carcinogen. Carcinoma means a type of tumor that is what? Carcinogens are things that produce what? Carcinoma means cancer. Okay, so carcinoma is a cancerous tumor. A carcinogen is something that produces cancer. Cautero, like cauterization, that's pretty much the only time you're going to need to know that. Cauterization. When surgery is being performed, a lot of times what is actually done to reduce the amount of bleeding is cauterization during surgery. And when cauterization is performed, the area that's being performed, that surgery is being performed on, excuse me as my brain stops working, is burned, and burning the area kind of closes everything, makes the blood stop flowing in the area, and reduces blood flow. So cauterization, cautero means burn. Chemo, like chemotherapy. And you should be able to figure this out just by looking at the name. Chemotherapy is therapy that involves using chemicals. Now, chemotherapy is used to destroy tissues and cells in the body that we don't want in the body, that could be cancerous, could be harmful to our health. So they can also destroy healthy cells too, so that's kind of the trade-off there. But yeah, definitely a good thing, chemotherapy. Cryo, like cryotherapy. And when we use cryotherapy, we are using cold, something like ice or cold packs, or even cold baths are forms of cryotherapy. Anything that we use, we mainly use cryotherapy to reduce the amount of inflammation in the body. It can be systemic inflammation or it can be localized inflammation. It just lowers the amount of inflammation because it causes blood vessels to constrict. And when the blood vessels constrict, they're less permeable, and that doesn't allow fluids and blood cells and stuff to enter into those areas and cause inflammation. Okay, histo, like histology. Well, this is kind of something that is performed when biopsies are done. When biopsies are performed, a doctor will kind of remove a piece of tissue from the body and then examine it under a microscope and see if it is a form of cancer or not. And I've had a biopsy performed. You can watch that video on my Facebook page, facebook.com/MBLEx test prep. It's really simple. You just took a small razor blade, numbed the area first, of course, took a small razor blade, shaved off a piece of the offending area, and came back a few days later and said it was scar tissue. Even though I told him it was scar tissue to begin with, he still said, you know what, I want to biopsy that just to be sure. And sure enough, it was exactly what I told him it was. So go watch that video. Anyway, histology, study of tissue. So examining it is performing histology. Muta, like mutation or mutagen. Mutation is when something does what? Mutagens are things that produce what? Changes, specifically genetically. So when a genetic change occurs, something can happen like cancer. which is specifically why this is in the oncology word roots section. So genetic changes to a person's body can then result in them developing tumors that may not have occurred otherwise. So doing something like smoking might increase your chances of developing something like lung cancer because it could possibly change your genetic information, your DNA, and make you more susceptible to it. Okay, onco, like oncology. Some people might say cancer, and you're close. Oncology is not the study of cancer, though. Not all of these things that we are studying in oncology are considered cancer. Oncology is tumor. Okay, so you can have tumors that aren't necessarily malignant, that don't spread throughout the body, of course. So oncology, study of tumors. Sarco, like sarcoma. What does sarcoma refer to? Well, oma means tumor, right? Sarco would refer to a tumor in what part of the body? A tumor of connective tissue. Okay, so these are going to be a little more severe than like carcinoma that affect like epithelial tissue, like basal cell carcinoma. Sarcoma involves connective tissues, which are typically deeper in the body, more susceptible to spreading of cancer. Okay. Miscellaneous word roots. So these are word roots that don't necessarily apply to other systems. You'll see what I mean. Okay. Ori, like oracle. What do you think? What part of the body do you find the auricle in? The auricle is part of the ear. Okay, so anytime you see auricle, you know it has something to do with the ear itself, like the physical structure of the ear. Not hearing, but the ear. Bio, like biology or biometrics. Microbiology. Antibiotics. How about that one? That's a good one. Biology is the study of life. Biology, study of life. Man, it's just that easy. Biology, of course, takes us back to high school, right? Biology class in high school. Now it's a little more intense. You got anatomy and physiology, which are both, of course, a part of biology, a branch of biology. But, you get it. Chiro, like chiropractic. Now you might think joints, you might think bones. Neither of those are it. Of course, chiropractors, when they do their manipulations, they are using, for the most part, hands. Okay, so chiro means hand. Coraco, like coracoid process. Now, a lot of people have trouble with this one. Coraco. Again, oid means resembling. So the coracoid process resembles something. If you know where the coracoid process is, it is on the anterior scapula, kind of sticks out. You can kind of palpate that just below the clavicle near the shoulder joint. It kind of sticks out right there. Again, it's named after what it looks like. It resembles a crow's beak. Okay, so coraco means crow-like, resembling a crow's beak. A crow's beak is kind of long, and rounded towards the end a little bit, and that's kind of what the coracoid process looks like. So when these things were being named, a lot of times they named things after what they were familiar with in their part of the world in their specific time. Which is why the bicuspid valve in the heart is also called the mitral valve, because it kind of looks like the Pope's hat, which is called a mitre. So back in the day, I guess they were really familiar with crows, and they said, hey, this thing looks like the beak on a crow, so we'll call it the coracoid process. Anyway, corono, like a coronary artery or coronoid process. Now, the coronoid process, you have a couple of those. One is on the ulna, one is on the mandible. Of course, it's like a sharp point that comes up. Looks like the point on a crown. Okay, think about corona. The beer means crown. Corona. The coronary artery kind of wraps around. You have two coronary arteries. They wrap around the heart. Kind of makes a crown, I suppose. A dorso, like dorsal. The dorsal surface of like my hand is considered the back of the hand, and you. And the opposite of dorso is ventral, which means front or belly. So you can even think of a fish. Also, a dorsal fin on a fish is on its back. Okay, ecto, like an ectopic pregnancy, or ecto-cooler, the high C Ghostbusters drink. Of course, ectopic pregnancies specifically are when pregnancies occur outside of their normal location. Outside of the uterus, not a good thing. They don't survive. Yeah, moving on. Like glaucoma. Now this is a color thing. So think about somebody with glaucoma. That's an eye condition, right? What do the eyes look like in somebody with glaucoma? What specific color do they kind of look like? Somebody with glaucoma, the eyes look gray. They have a grayish color to them. They get kind of cloudy, I suppose, and have that grayish color. Hydro, like hydrate, hydration. Hydronephrosis is another example. So hydronephrosis is kind of a pretty serious thing. So hydroneph, of course, neph means kidney, osis, condition. Something is building up in the kidneys. Hydro, like hydrotherapy, is another example, is water. Okay, so hydronephrosis is basically when you have too much fluid in the kidney. For some reason, the kidney can't properly get rid of all the fluid that's building up inside of it. Not a good thing. To hydrate is to put more water into your body. Hydrotherapy, water treatment. Okay, ophthalmo, like ophthalmology. An ophthalmologist is a doctor that specifically studies the eye. And that's about all I can say about that one. So moving on. Pyro, like pyrogenic or antipyretic. An antipyretic is a type of medication that, the prefix anti means against. So it works against something specific. When we see pyro, we think fire, right? What does fire create? Why do we huddle around a fire? Because fires produce heat. So if something is pyrogenic, it produces heat. If we take an antipyretic, we are trying to lower our body temperature. It works against heat. Typically, fever is what you would use an antipyretic for. So when your fever gets way too high, like 103, 104, that's when you would use an antipyretic to lower that body temperature back down to a safe level. So fever is actually good for us in the short term, as long as it's not too high, because, just like us as people, viruses and bacteria can't really survive in those elevated temperatures. So that's why our body increases those temperatures, produces a fever, and tries to kill off the bacteria or virus. And if it's there for too long or it gets too high, then it can also kill us. Not a good thing. Okay, thermo, like thermometer or thermoreceptor. A thermoreceptor is a type of sensory receptor that detects. A thermometer is a type of device that measures, again, heat. So a thermometer determines how much heat an object has. Thermoreceptors detect heat. Viscero, like viscera, or visceral serous membrane. The serous membranes are membranes that surround organs, and the visceral serous membrane. There are two membranes that make up a serous membrane: the visceral serous membrane and the parietal serous membrane. And between those is fluid that helps you cushion these organs. Okay, the visceral serous membrane is going to be the more internal of the two. It's going to be the one that comes into contact with the organ specifically. Then you got the fluid surrounding that, and then the outer membrane is the parietal serous membrane. So the visceral serous membrane, if you just remember, the visceral serous membrane is more inside than the parietal serous membrane. That's a good way to remember it. So viscera means internal. Viscera refers to organs, our internal organs, right? All right, so we're done with word roots. So most of our structures that we've already talked about, we've got covered. So prefixes don't really necessarily apply to all of these structures. They are descriptive terms that say when there is something or there isn't something, or if there's too much or too little. So we'll just start with prefixes. So prefixes come at the beginning of a word. So you're always going to find a prefix before you find a word root. And some words have all three: prefix, word root, and suffix. Some only have two. Some don't even have a word root. Some it's just a prefix and a suffix. But again, sometimes prefixes and suffixes can mean physical things in the body. Mostly suffixes you're going to find that with, but I don't know. It's a weird thing. Medical terminology is weird, which is why we're going over it so you get a better grasp of it. Okay, prefixes. So A, and examples are avascular or arrhythmia. So if something is avascular, what does it have to do with blood flow? Does it have blood flow? If our heart has arrhythmia, does it have rhythm? No, it doesn't. Without. A means without. So avascular, without blood flow. Arrhythmia, without rhythm. Ab, like abduction. If I were to be abducted by aliens, which has happened before, I would be taken away. So when you're performing abduction of the shoulder, you are moving the structure away from the midline, right? What about add? Like adduction. Or, we talked about this earlier, the adrenal glands. So adduction is the opposite of abduction, right? Abduction, you're taking a structure away. Adduction, you are moving the structure towards the midline. The adrenal glands, ad means towards, renal, kidney. They're the glands that are toward the kidney. They sit right on top of it. Okay, af, like afferent. Now these specifically, afferent and efferent, specifically refer to impulses that are traveling either to or from the brain to either detect sensation or to tell us how to respond to sensation or stimulus. Okay, so afferent impulses travel towards the brain. So af means towards. Okay, so afferent, those are our sensory impulses that travel towards the brain or spinal cord for processing to determine if this stimulus that we are feeling is something that is putting us in danger and how to respond to it. Okay, so af means towards. An, like anemia. Here's one of those that has a prefix and a suffix. Emia is a suffix. An is a prefix. So an, what does emia mean? Like hyperemia, leukemia. Emia means a blood condition or just blood, okay? Anemia means without blood. So a or an mean the same thing, without. So anemia is basically what would happen. It's kind of a general term for how your body would respond if you didn't have blood in it. So if you didn't have blood, you wouldn't get oxygen, right? That's when you were considered an anemic. And there were different types of anemia, of course. Iron deficient anemia is the most common one, where you're not eating enough iron, don't have enough iron in your in your red blood cells, your erythrocytes, and that could reduce the amount of oxygen, carbon dioxide getting in and out of your body. So anemia, and without blood. So you can have anemia because you have lost too much blood. Like if you suffer a really severe cut and you lose a lot of blood, that could make you anemic as well. And then there's sickle cell anemia, where the erythrocytes have really weird shapes. They're shaped like sickles, and oxygen, carbon dioxide have a really hard time attaching to those. And they have a hard time kind of moving throughout the bloodstream as a result. So anyways, anemia without blood. Anti, like antibiotic, or think about muscles, antagonist. And of course, there are a lot of medications, not just antibiotics, but a lot of medications that have the word anti at the beginning, because anti means against. Okay, so antibiotics work against life. Is what it kind of the term boils down to. Their antibiotics kill bacteria. Okay, antagonists work against agonists to perform the opposite action. Like if gastrocnemius plantar flexes, the antagonist is the muscle that dorsiflexes, like tibialis anterior. Okay. Auto, like autonomy. How about automobile? Autopilot. Lots of examples of auto, of course. Autonomy, specifically self, so you are self-governed, so you make choices for yourself. Bi, like biceps brachii. Now, this is different than bio, which is the word root, right? Biceps. So remember, sep means head. Biceps has how many heads? Bicep has 2 heads. What about Brady or Brady? And pretty much the only example you're going to know is bradycardia, which is a form of arrhythmia. So bradycardia, our heart's rhythm, is kind of irregular in some way. What's going on with our heart's rhythm if somebody has bradycardia? If somebody has bradycardia, the heart's rhythm is too slow. Okay, it's just not working really as quick as it should at all in any way. Okay. So again, that's a form of arrhythmia, bradycardia. Circum, like circumduction, or circumcision, or circumference. So when you're performing circumduction in your shoulder, what are you doing in regards to the circumference of the joint? You're moving the structure. When somebody gets a circumcision, cision means cutting, right? So it's cutting. Think about their circumference. Circumference. That has circum in it, of course. Around. So if you measure the circumference of something, you're measuring the distance around it. When you're performing circumduction, you're moving the joint around the circumference of the joint. When a circumcision is performed, they are cutting around the structure. Okay. Contra, like contraindication. Contraindication, something we maybe can't do, right? Something is not indicated for a treatment. Contra means against. Just like anti, contra means against. Dia, like diameter or dialysis. So if we were to measure the diameter of something, we are measuring what distance? When somebody's having dialysis performed, their body can't eliminate enough waste, right? So somehow we have to get that waste out of the body. Dia means through. So to measure the diameter of something, you're measuring the distance through it. Dialysis, we're filtering waste through either the peritoneum, the abdominal peritoneum, or through a machine that can pull the waste out and then return the blood back into the body. Okay. So it goes through the peritoneum or through a machine for filtering. Dys, like dysfunction or dysmenorrhea. So if something is dysfunctional, what kind of function does it have? Dysmenorrhea. Now that refers to menstruation, right? We see meno, menstruation. Rhea means discharge. So what's going on with our menstrual discharge? Some words are just gross. Discharge is one of those. Dysfunction. If something's dysfunctional, it has a difficult function. Dysmenorrhea. Maybe you're not having good menstrual flow, discharge for a certain period of time, and I'm moving on because it's just getting more awkward for me. Efferent. So we talked about afferent, right? Afferent goes towards the brain or spinal cord. Efferent, after the impulse goes towards the brain or spinal cord, one of those structures will process that information and then send an impulse back away from a center. F means away. And those impulses are motor impulses. Okay, so we have a couple different types of impulses, right? We have afferent impulses and efferent impulses. Just think of the word same. Sensory afferent, that's the SA part of same. Motor efferent, that's the ME part of same. So our sensory impulses are the afferent impulses that go towards the brain and spinal cord for processing. Our motor impulses are the efferent impulses, and they go away from the brain to tell us how to respond to a stimulus. Okay, endo, like endocrine or endoscope. Endocrine glands secrete hormones, right? They secrete them where? What makes them different than exocrine glands? These are called endocrine glands because they secrete their hormones within a structure, like the bloodstream. Okay. Endoscope is a scope that goes within a structure. It can go into like the esophagus or the stomach or the large intestine to get a better view of what's going on. You can even go all the way into the small intestine too from the stomach, just to really see what's going on. Usually in the digestive tract you see endoscopes. Epi, like epidermis or epinephrine. So we already talked about dermis, right? Skin. And we've mentioned epinephrine a couple times. It has something to do with the kidneys. Neph, we got rin, which means secrete, and we'll get to that once we get to suffixes. Epi, what about epicondyles? Where are the epicondyles in relation to the condyles on bones like the humerus or the femur? Epicondyles are above the condyles. Okay? Epidermis is the layer above the dermis. Epinephrine, above kidney secrete. Exo, like exoskeleton or exocrine. Insects, like cockroaches, have exoskeletons. Exocrine glands, a couple examples of those are the sebaceous glands, the sudoriferous glands, your salivary glands are exocrine glands. Now, the difference between exocrine glands and endocrine glands is not just what they make, but where they specifically empty their contents. So endocrine glands secrete into or within the bloodstream. Exocrine glands secrete outside of a structure or onto a surface, right? Think about exoskeleton. Insects like cockroaches have their skeleton on the outside. So it makes them extra crunchy because you can actually hear their skeleton breaking when you maybe step on them or something. So exocrine glands secrete outside or onto a surface. Okay, hemi, like hemisphere, or hemiplegia. Plegia means paralysis. So what is paralyzed if somebody has hemiplegia? Think of our planet split into hemispheres. Think about the brain split into hemispheres, right? Hemi means half. So we have an eastern hemisphere or northern hemisphere, southern hemisphere. We have a left hemisphere, a right hemisphere. Hemiplegia is when one half of the body is paralyzed, either the left side or the right side. Something like a stroke could cause hemiplegia. Okay, hemi means half. Hyper, like hypertension, or hyperkyphosis. So I know a lot of people think hyper, a lot of energy, right? Crazy, too much, too much, too much, too much, excessive. Hyper means excessive. Okay, so hypertension, excessive tension in the arteries. And we measure hypertension. What hypertension, when we are testing for hypertension, we're specifically measuring the amount of pressure felt in the walls of the arteries as blood passes through them and then doesn't pass through them. So if there is too much or excessive tension, then we have hypertension. Hyperkyphosis is another term for kyphosis. Some people say hyperkyphosis. It's the same thing. There's no difference between regular kyphosis and hyperkyphosis. It's that exaggerated curvature, excessive curvature of the thoracic vertebrae that causes that hunchback appearance. Hypo, like hypoxia or hypothermia. Hypoxia, I see oxy, that has something to do with oxygen, I'd imagine. Hypothermia, thermo means, again, temperature, right? We just went over that. Thermia, temperature, hypo. So hypothermia has something to do with our heat, our body's heat. Hypo means below. So if somebody has hypothermia, wow, my mouth completely stopped working right there. If somebody has hypothermia, the body temperature is too low. It drops below a safe level. So usually it's below about 95 degrees. Once you hit that point, then you start kind of showing the effects of hypothermia. Okay, hypoxia is something that can kind of be associated with hypothermia as well. Your body doesn't have enough oxygen in it for whatever reason. Either you could be at altitude. Sitting here, I'm at about 4,600 feet above sea level, so my body's kind of used to less oxygen. It's developed ways to get more oxygen. But if you are at sea level, I know a lot of you are. A lot of you listening are around sea level or maybe a little above sea level. You come up here to where I'm at, maybe you're going to be feeling a little bit of the effects of the altitude that we experience. And some of you are even higher up than I am right now. People in like Denver and stuff, maybe higher elevation. Anyway, hypoxia, below oxygen. Like the interosseous membrane. The intertubercular groove is another one. So the interosseous membrane has something to do with like the tibia and fibula, or the radius and the ulna. Where do you find the interosseous membrane? Osseous, of course, refers to bone. So it has something to do with the bones. Inter means between. So the interosseous membrane is between the bones. The intertubercular groove on the humerus is between the greater and lesser tubercles. And it's where the tendon of the long head of the biceps brachii travels. Intra, a couple examples, intravenous or intradermal. Specifically, intradermal is going to refer to injections. Okay, so intravenous, IV is the common abbreviation for intravenous. IVs go where? In relation to veins, as we see vein, V-E-N. Intravenous means inside the vein. Intradermal means inside the skin. So both of the intravenous IVs go inside veins. Intradermal injections go inside the skin. Iso, like isometric or isotonic, and we kind of talked about this a little bit earlier. Isometric means same length. Isotonic means same tension. So Again, with isometric and isotonic, something stays the same. Just look at the name, but something else changes. Just switch those, and that's what changes. Isometric, the tension changes, but the length stays the same. Isotonic, the tension stays the same, but the length changes. Macro, like macrophages. Macrophage is a type of cell, and we just remember phago, we see P-H-A-G. That means what? It's what I love to do. It's why. It's what leukocytes do. Leukocytes eat things, right? So macrophages are large cells that eat things. So there are a lot of different types of leukocytes. A macrophage is one of them. It's a large cell that eats things, as opposed to micro, which we'll talk about in a minute. Mal. Now, here's the fun thing about medical terminology, because a lot of it is based in Latin. If you know a Romance language like Spanish or Italian or French or Romanian or Portuguese, then you already know what a decent amount of these mean because they match up. And here's a perfect example. Mal. If you know what mal or mal means in Spanish, then you know what it means here. Like malignant or malformation. So what does it mean? It means bad. Okay? So if something is malformed, it was formed badly. Mal or mal in Spanish means bad. Think of Darth Maul in Star Wars. I didn't think I'd be making a Star Wars reference today. I'm not a Star Wars kind of guy. But he's a bad guy, right? Anyway, moving on. Meta, like metaphysis. So in a long bone, we have three main parts, right? We have the epiphysis, which are the ends. We have the diaphysis, which is the shaft. And in between those, on both sides, is the metaphysis. So what happens at the metaphysis of the bones? And then another name for the metaphysis is the epiphyseal plate. It's a thing of cartilage. Now, why would we have cartilage in our bone? What has to take place at that cartilage? Specifically, change in the bone takes place. It's where the bone grows, at the metaphysis, or the epiphyseal plate. And once you reach about age 20, 21, the metaphysis ossifies. It turns into bone instead of cartilage, and then your bones stop growing. So that's essentially how tall you're going to get at that stage. Okay, micro, like microscope or microbiology. So this is kind of the opposite of macro. So macro is large, right? Micro is small. Microscope is something that allows us to view small things. Microbiology, the study of small life, like cells and bacteria. Stuff that you can't see with the naked eye. Okay, mono, like monocyte, mononucleosis, or monorail. The Simpsons did an entire episode about the monorail. Las Vegas has a monorail. Monorails go in, have how many rails, I suppose? One. Monocyte, one cell. Okay. Neo. Don't say the Matrix. Please don't. Just don't do it. Drives me nuts. It hurts me on the inside when people do that to me. Neopathic is an example. Neonatal is another example. So when we're talking about neonatal, we're talking about infants, right? When we talk about something being neopathic, path means disease. What type of disease is a neopathic disease? If something's neopathic, it's considered a new disease. Neonatal refers to like infants, right? New people. Makes sense. Pan. Now, if you know Spanish, you know that pan means bread, but that doesn't apply here. Unfortunately, it doesn't always match up. All right, pandemic. So we once in a while, we have to deal with global pandemics. What about a panoramic photograph? If I were to take a panoramic photograph, how much of the environment am I able to see in that panoramic picture? I think I should be able to see all of it. Pandemics involve all people. Now, that doesn't mean if there's a pandemic that every single person on the planet is going to get this disease. It just means a really large number of people are going to get it. When all the continents were together as one, they were all together. It was called Pangea. Pan. Okay. Para. Not two. Not a pair of. Para, like parathyroid. Where's the parathyroid in relation to the thyroid specifically? It's considered beside the thyroid. So parathyroid is beside the thyroid. Okay, peri, like the pericardium or the periosteum. Where's the pericardium in relation to the heart? Where's the periosteum in relation to bone? Both of those you can find around those structures. So the pericardium is a serous membrane around the heart. Periosteum, connective tissue around the bones. Poly, like polycystic ovarian syndrome, which I referenced earlier. So what do you think, poly? Now, if there was one cyst, it might just be called cystic ovarian syndrome, right? But because there is more than one cyst, it's called polycystic ovarian syndrome. Poly means many. So it's not just one, it's not just two, it's many cysts. I'm telling you, you got to look at that photo of my wife's ovary. That is such a weird thing to say, I just realized. Look at that photo, try to count how many cysts there are, because how many you can count, there are even more in there. It was quite the experience, taking a picture of that. Anyway, poly means many. Pseudo, like pseudoscience or pseudoephedrine. If something is considered pseudoscience, that means it is false. Pseudoephedrine is something that mimics ephedrine but isn't actually ephedrine. So it does the same thing as like ephedrine, it just isn't ephedrine, if that makes sense. Okay, retro. Specifically, retro, when we're talking about the body, refers to positions of things in the body in relation to other things. So the kidneys are in a retroperitoneal position. This is one of the only instances I can think of where you'd actually use this term. So retroperitoneal has something to do with the peritoneum and where the kidneys are. The kidneys are behind the abdominal peritoneum, that serous membrane in the abdomen that holds everything kind of inside of it and keeps everything protected. The kidneys are behind that, so they aren't really protected by the peritoneum. They're behind it, right up against the floating ribs. Okay, like semi-membranosis. Yeah, that's pretty much, that tells you the name of, why it describes that muscle pretty well, the name semi-membranosis, when you know that semi means half. So it's half muscle and half membranous tissue. That's what makes the semi-membranosis. Yep. Sub, like subscapularis. Or how about subway or submarine? Submarines go where in relation to water? They go under water. The subscapularis, even though it's on the anterior surface of the scapula, if you have somebody, face down, the subscapularis is considered under the scapula. A subway goes underground, right? And super, like superior. Now, when we move a structure superiorly, when we contract certain muscles, like levator scapula, if we contract levator scapulae, it moves the scapula superiorly. elevates the scapula. Superior means above, so it's going higher than something else. Think about the vena cava, the veins that bring blood back to the heart. You have one that's above the other, and that would make that the superior vena cava. The other one, the inferior vena cava. What about the anterior superior iliac spine? There's also an anterior inferior iliac spine. The superior is above the inferior. Okay, supra, like supraspinatus or supraglenoid tubercle specifically. The supraspinous fossa is the fossa you find above. So it kind of branches off from superior into supra. So you're going to use that when you're combining terms like supra with spinatus or supraglenoid, above the spine of the scapula or above the glenoid fossa. Okay. Sem, like symbiosis, when it has something to do with two things in their relationship. Or a symphony, everybody's playing their instruments all together. What about pubic symphysis? Holds the pubic bones together. Then syn. What about synergist or syndrome? A synergist is a muscle that does what with an agonist? It works together with an agonist to perform an action. A syndrome is when we have signs and symptoms occurring together. Okay, tachy. Here's another form of arrhythmia that you should probably know, tachycardia. So we got bradycardia, which, brady means slow. You have atrial fibrillation, and then you have tachycardia. So if bradycardia is the heart rhythm, the heart's beating too slow, tachycardia is kind of the opposite. The heart is beating rapidly, way too fast, for whatever reason. Okay, so tachy means rapid. And trans. A couple examples: transdermal, like transdermal patches are patches that you apply to the skin that have medication on them. Transient, transient ischemic attack, TIA. It's considered a mini stroke. Trans means through. Okay, so transdermal medication, again, is like a patch or a cream or something that you put on the skin that works its way through the skin into the blood, and it works kind of that way. And it can do things like you can have transdermal patches that slowly release pain medication in them. So trans, you get it. All right, so now let's talk about suffixes. So suffixes, prefixes come at the beginning of the word. Suffixes come at the end of the word. So usually you have kind of the word root right in the middle of those. If you have all three, yeah, you get it. You get it. Okay, moving on, suffixes. So, whoa, look at this one. Whoa. So there are a lot of these. Ac, al, ar, airy, eel, ick, ickle, ile, in, ori, os, aus, tick. All right, here's some examples. Iliac, iliophomoral, coronary, febrile, ambulatory, adipose, cutaneous, septic. These are all kind of designed to kind of clean up the word a bit. All of these just mean referring to. So iliac is referring to the ilium. Okay, iliophomoral referring to the ilium and femur. Coronary referring to the crown, usually like the coronary arteries, and so on and so on. Cutaneous referring to the skin. Okay, so you see these at the end of words, and it just means referring to. Not that you really think that hard about it, but you got it. Algia, like neuralgia, or how about fibromyalgia? Neuralgia, like trigeminal neuralgia, we kind of talked about that earlier. Something happens to the nerve. What's happening in the trigeminal nerve? You are experiencing pain. And that's one of the main things that you see with fibromyalgia, right? Fibro means fiber, my means muscle. Algia means pain. Clast, like osteoclast. So if osteoblasts are responsible for building tissue, they are germ cells that build tissue. Osteoclasts are cells that break down tissue. So clast means break. Okay, so osteoclast, if there's some sort of injury to a bone or something like that, osteoclast will go into the area and really kind of break down the dead tissue or the damaged tissue and give the bone kind of a clean surface, and then osteoblasts can build more tissue in those areas after the osteoclasts have cleaned them up. Crine, like endocrine or exocrine. Now these are glands, right? And what do glands do? Like endocrine glands, they make hormones, and then they do what with the hormones? Exocrine glands make stuff like sweat and oil and saliva, and then do what with those? They secrete. Okay? So endocrine means within, secrete. Exocrine, outside, secrete, or surface. You get it. Moving on. Cyte. Erythrocyte or osteocyte. Okay, so an erythrocyte is a type of blood cell named after a color, right? I just gave it to you. I just told you. Cyte, cell. Osteocyte is a bone cell. Okay, erythrocyte is a red blood cell. Leukocyte. There are so many different types of cells in the body. It's hard to keep track. Thrombocyte, cell that clots. Okay. So anytime you see cyte at the end of a word, it's some type of cell. Okay, derma, like scleroderma. And we talked about this earlier. I told you this was one of the examples I gave where a suffix or a prefix can also be a word root, just kind of switch around in the order it's put. So scleroderma, as sclero means hard. What becomes hard in scleroderma? The skin. Okay, derma means skin. Ectomy, like appendectomy or hysterectomy. And we talked about hysterectomy earlier. It has something to do with the uterus, right? What happens to the uterus in a hysterectomy? Appendectomy has something to do with the appendix. Pretty much the only time anybody ever deals with the appendix is when they're having it surgically removed, right? So surgical removal. Hysterectomy, surgical removal of the uterus. Appendectomy, surgical removal of the appendix. Edema, like pitting edema. When somebody is experiencing edema, and this is one where you could just see edema by itself. It doesn't even have to be attached to anything. Edema is just swelling. So it's an increased amount of fluid in an area. So the difference between edema and inflammation is what type of fluid is in the area. Edema is typically water, lymph, stuff like that. Inflammation is specifically blood, which is why inflammation can feel warm to the touch and has a reddish color to it, whereas edema does not. Edema usually feels kind of cold and kind of clammy in the area. Okay, emesis, like hematemesis. So hemat, we see hemo in there, right? So that has something to do with the blood. What is emesis? Now, I did mention I do this quite a bit. Honestly, it hasn't been. It hasn't been a regular occurrence in a while, but once in a while, I experience emesis. Well, the last time I experienced emesis was probably about a year ago, and I drank some miso soup, and I put some hot sauce in it that I didn't realize was like super, super, super hot. and it was like on an empty stomach, and I needed to get it out of my stomach because it was causing me a lot of pain and discomfort. So I made myself, of course, vomit. So hematemesis is blood in vomit. So if somebody's got some major stomach issues, they might experience that. But just emesis by itself is considered vomit. So here's another example. Edema and emesis, you can use those terms by themselves. Don't even have to attach those to anything else to use those. Okay, emia, like hyperemia or septicemia. So something is septic, that means there's some sort of infection or it's just gross stuff, right? Hyperemia, when somebody gets a massage, the area the massage therapist is working on becomes red, right? Blood vessels dilate and bring more what into the area? Blood. Leukemia is another example. It's a type of cancer of the blood cells, specifically the leukocytes. So hyperemia, excessive blood flow in an area. What about ischemia, lack of blood flow in an area? Okay. Septicemia, it's like a, what's the word? Septicemia, blood infection, I suppose. You have a systemic infection throughout it, usually bacterial, not good. Aesthesia, like anesthesia or paresthesia. Didn't we talk about this one? There's another example. Aesthesia, aesthetic. Anesthesia, anesthesiology, sensation. So anesthesia without sensation. Paresthesia, it's like abnormal sensation, like pins and needles sensation. Like when your foot falls asleep and you're trying to get it to wake up. It's kind of painful, pins and needles. Yeah. So afferent. So we talked about these earlier, afferent and efferent. Afferent impulses and efferent impulses mean to carry. Okay, so afferent means towards, to carry, or sometimes you just switch those around and make it proper English, I suppose. To carry towards. Efferent, to carry away. Okay, so af towards, f away, ferent carry. Okay, gen, like carcinogen or pathogen. So a carcinogen has something to do with, do we remember carcino? Means cancer. Patho means disease. Okay, so these are gen means produce. So these are things that produce cancer or produce disease. Okay, so something like fungus could be a pathogen in regards to athlete's foot or jock itch or something like that. Okay, gnosis, like this, the G is silent. But with these examples, diagnosis, prognosis, you pronounce the G. So a diagnosis is when we figure out what something is, right? We say this is the disease that we are dealing with. A prognosis is saying this is the recovery rate of your disease. This is the expected outcome of your disease. A prognosis, okay? Gnosis means knowing. It's I know what this disease is. I know that this is your recovery rate. Okay? Gram, like electrocardiogram. An electrocardiogram, electricity, cardio, heart, has something to do with the heart. We're measuring the heart's activity. Okay? So we're recording the heart's activity using an electrocardiogram. And that tells us if the heart is beating regularly, if it's beating too hard or not hard enough, or if there's something like atrial fibrillation, or if we're having cardiac arrest, stuff like that. Lots of stuff we can decipher with an electrocardiogram, EKG or ECG. EKG, again, that goes back to our Latin and Greek. EKG, cardio, can be spelled with a K in one of those languages. I think it's Greek. They spell it with a K. Graph, like an electroencephalograph, is a specific device. So a graph is the record, or a gram is the record, and a graph is what we use to actually record the information, if that makes sense. So the graph specifically is the machine being used to record the information. The gram is the recorded information. Okay? So an electroencephalograph, again, electricity, encephalo, en means in, sep, head, inside the hep. Inside the head is the brain, and it's a graph, of course. Iatry, like pediatry. So pediatry is a form of medicine, right? So you see iatry on the end of something that it's refers to some sort of medicine. Podiatry, the same thing, right? It's foot medicine, basically. Ishin, like physician. Musician is another example. A physician is somebody that is a specialist. So a musician is somebody that specializes in music. Physician studies in physiology, or specializes in physiology. Okay, ist, like dentist or massage therapist. So what makes these people different? A lot of this stuff we all kind of share in common, the stuff that we study, but it's when we start to specialize in some of the stuff that we become different things. So a dentist is somebody that specializes in dento, the teeth. Massage therapists specialize in massage therapy, right? Itis, like hepatitis, dermatitis, we talked a lot about this. Itis, anytime you see itis, there's some sort of inflammation present. Okay, itis means inflammation, and you should know that one. Okay, lysis, like electrolysis or dialysis. Now, when we get electrolysis done or dialysis done, we're trying to dissolve certain things. Electrolysis, people get electrolysis done to dissolve like hair. Dialysis, to get some of the waste products out of the blood that the kidneys can't properly filter themselves, it dissolves the waste products to eliminate them. We don't get like just a bag of waste products at the end of it. It actually dissolves the waste products so that they can be properly removed. Oid. Now, I talked a lot about this one too, like coracoid. Remember, corico means crow-like. Sesamoid, like a sesamoid bone, like the patella or the pisiform. Those are sesamoid bones. Oid means resembling, okay? So coracoid means resembling a crow's beak, crow-like. Sesamoid means resembling a sesame seed because the patella and the pisiform look like sesame seeds. Okay, oma, like melanoma or carcinoma, lymphoma, hematoma. And these are all kind of a buildup of a substance or a tissue that produces a tumor. So melanoma means black tumor. Melano means black, oma means tumor. Carcinoma means cancerous tumor. Carcin, cancer, oma, tumor. And I just kind of gave that one to you. Sorry, my computer was a little slow. Osis means condition. You see osis with a lot of things. It actually does have more definitions than just condition, but the main one you see about 80% of the time, it's going to mean condition, like atherosclerosis. Okay. Other definitions can be process or formation, like mitosis, cellular mitosis, where cells divide. That's a process. Yeah, so, but for the most part, osis. Anytime you see osis, it's almost always going to mean some sort of condition. Okay. Pathy, like encephalopathy. Now, we kind of went over this a couple minutes ago. Path. Encephalo means brain. Chronic traumatic encephalopathy means there's something going on with the brain. It is a brain disease. Okay, so path, anytime you see path, it has something to do with disease. Pathogens are things that cause disease. Physis, like the epiphysis or diaphysis or metaphysis. Specifically, what happens at the metaphysis? We kind of talked about this earlier with meta, right? What happens to the bone at the metaphysis? Growth takes place. Okay, so epiphysis, diaphysis, metaphysis all experience growth. Plesia, like paraplegia or quadriplegia. If somebody is paraplegic or quadriplegic, or if they're experiencing hemiplegia, they are experiencing some sort of paralysis. Okay, so if somebody is paraplegic, typically they can't use their legs. If they're quadriplegic, typically it's everything from the neck down that they cannot use. Right? Nia, like apnea or dyspnea. When it's like this, the P is silent, but you put an A in front of it, it becomes apnea. And when somebody has apnea, what are they not doing? Remember, A means without breathing. Reg. Mainly, you're just going to see it as part of hemorrhage. So hemo, again, means blood, right? So hemorrhage is when blood is doing what? A hemorrhage is basically when we're bleeding, right? So when we're bleeding, blood is bursting forth from its normal location. So bursting forth, it's just blood is exiting its blood vessels and exposing all of us to all of the wonderful things that blood has to provide, of course. Hemorrhage is bleeding. Rhea, like diarrhea, cha-cha-cha, or gonorrhea. So with, let's talk about gonorrhea specifically. What's one of the main, it's one of the main things that you might see with gonorrhea. If somebody has gonorrhea, not that you're specifically going to see it when you're doing a massage or anything like that, but if somebody has gonorrhea, a prime symptom is this. And think about diarrhea and what the two of those may share in common. Diarrhea, gonorrhea, both you experience discharge. Okay, so diarrhea, that sounds like diarrhea, right? Gonorrhea, you do experience a kind of a milky white discharge from the genitals if you have gonorrhea. Okay, tomy, like anatomy. If you wanted to study the anatomy of something, like if you wanted to study my anatomy and all of my internal organs or something, what do you have to do to me to study my anatomy? Because you can't just look at me from the outside and say, "Oh, I know everything there is." To study my anatomy, you would have to, of course, perform an incision. You'd have to cut me open and take a look at all of my innards. I hope they're in tip-top shape. I hope. I don't know. You tell me after you perform an incision. What about trophy? The primary example is atrophy. So our muscles experience atrophy when they're not getting enough something. So it's not muscle degeneration. Our muscles don't degenerate when they atrophy. They might just get smaller in size because they are lacking a specific form of nourishment. And the primary nourishment for muscles is movement, right? So if I were to become paraplegic or something like that, I wouldn't be able to use my lower limbs. So those muscles, even though there is musculature in them right now, those muscles, as I stop using them, they would get smaller and smaller and smaller because there's no reason to have for the muscles to be that large if they're not being used. Okay, and it's the same thing like if I stop going to the gym and stop lifting weights and doing stuff like that, my muscles will get smaller because I'm not using them in a way that my body is kind of used to. So they're not getting that specific kind of nourishment, if that makes sense. So the muscles don't degenerate, they just get smaller in atrophy. Okay, so trophy means nourishment, atrophy without nourishment. So that just about wraps it up for medical terminology. Again, that was not every medical term that you could see. It wasn't even close. They're just the major ones that you probably should know. So make sure you study those, make those into flashcards. All of them flashcards. You can do them with examples or without examples. Just make sure you know your medical terms to make everything so much easier when it comes to studying and preparing for any test that you may take. Okay, so until next time, take it easy.